If you're planning a hospital birth and you want to breastfeed, there are 4 common interventions that can make breastfeeding harder in those first few weeks. And here's the thing, nobody's going to tell you this at the hospital. Not because they don't care, but because most providers don't understand the connection between what happens during birth and what happens when you try to nurse. Most lactation consultants aren't taught about the neurological and hormonal effects of these medications. Most nurses don't have time to explain the cascade of events that started during labor, and most OBs are focused on getting you and baby safely through delivery, which is important, but it leaves a massive gap because when you're struggling to breastfeed at 2 in the morning and nobody can figure out why baby won't latch or why your milk isn't coming in, it helps to know what might be affecting things. So let me walk you through what you need to know. 4 interventions: Pitocin, epidurals, IV fluids, and C-sections. Let's start with Pitocin. Pitocin is synthetic oxytocin. It's the hormone that causes contractions during labor. It's one of the most commonly used medications in labor and delivery. Over half of all the hospital births in the United States involve Pitocin at some point. Sometimes it's used to induce labor when you're past your due date. Sometimes it's used to speed up labor that's stalled. Sometimes it's given after delivery to help the uterus contract and prevent hemorrhaging. But here's what most people don't know. When you're given synthetic oxytocin during labor, your body can make less of natural oxytocin afterwards. Your body's smart and senses the synthetic version flooding your system and thinks we don't need to make as much ourselves. And that matters for breastfeeding because oxytocin is a hormone responsible for your milk letdown. When baby latches on and starts sucking, that stimulation sends a signal to your brain to release oxytocin. Oxytocin causes the milk ducts to contract and release milk. That's the letdown reflex. But if your body's making less oxytocin after birth because of the Pitocin you received during labor, it can be harder for your milk to release, which means baby gets frustrated. They're latched on, they're sucking, but nothing's coming out fast enough. So they pull off, they cry, and they thrash their head around. And suddenly you're being handed a nipple shield or a supplemental nursing system, or you're being told to pump and bottle feed, all because your letdown reflex is sluggish. The other thing Pitocin does, it crosses the placenta to the baby and can dampen their suck reflex. Think about it. Baby's been marinating in synthetic oxytocin for hours during your labor. Their little nervous system has been affected by it too. So baby's not sucking as effectively, they're not creating enough suction, they're not getting enough volume with each suck, they're not gaining weight as quickly as expected, and suddenly you're being told your supply is the problem. That's your body isn't making enough milk, when really you're just navigating the effect of this medication. Your body is making milk, baby just isn't transferring it effectively yet. And nobody told you that's a possibility. Next, epidurals. Epidurals are used in about 70% of the hospital births in the United States. They're incredibly effective at managing pain during labor. And I want to be clear, this is not about shaming anyone who chooses an epidural. Pain management is important. Your birth, your choice. But most people don't know what's in an epidural or how it affects baby. Most epidurals contain 2 medications, a local anesthetic like lidocaine and an opioid, usually fentanyl. A lot of people don't know that fentanyl is in most epidurals. When I tell pregnant moms this, their eyes get big because they've heard of the opioid crisis. They know fentanyl is strong and nobody at the hospital mentioned it. The amount of fentanyl in an epidural is small, much smaller than what's used for surgery or pain management in other contexts. But it does transfer to baby and it does reduce their neurological reflexes. So here's why that matters for breastfeeding. Babies are born with an instinct to crawl to the breast and latch on in the first few hours of birth. It's called the breast crawl. If you put a newborn on a mom's chest right after delivery, they'll actually use their little arms and legs to inch their way up towards the breast. They'll bob their head around, smelling and rooting, and if given enough time, they'll latch on themselves. It's incredible to watch. Baby gets good latch in the first hour. It sets up the entire breastfeeding trajectory. It programs the brain. It triggers milk production in mom. It establishes a rhythm. But epidurals, that makes it harder. Babies' reflexes are dampened by this medication. They're sleepy. They're shaky. They can't coordinate the complex movements they need to latch well. Their reading reflex might be weak. Their suck, swallow, breathe coordination might be off. They may not have the muscle tone to sustain a deep latch. And if the first latch doesn't happen well, or doesn't happen at all in that critical first hour, milk supply can lower from the start because that first hour is when your hormones are primed. Your oxytocin is surging, your prolactin is sky high. Your body is ready to respond to baby's cues. But if the baby can't give those cues effectively because those reflexes are dampened, your body doesn't get the message. If you have an epidural, you might need more hands-on help getting baby to the breast in the first hour. Skin to skin is critical. Even if baby can't latch right away, keep them on your chest helps activate those reflexes. Bringing baby down to the breast, supporting their head and body, helping them find the nipple, giving them time to figure it out instead of rushing in with a bottle. And knowing that it might take longer, that baby might be sleepier for the first day or 2, that you might need extra support from a lactation consultant who understands the neurological effects of epidurals. Here's the good news about both Pitocin and epidurals. The hardest time is typically the first 6 weeks. Studies show that by 6 weeks, the effects of the medications have cleared. And there's no difference in breastfeeding success between moms who had interventions and moms who didn't. But that's the first 6 weeks. That's when most breastfeeding moms stop. because it's so hard and they're getting bad advice when really they just need to get through those first 6 weeks. The third intervention's IV fluids. This one seems harmless. You're in labor, you can't eat or drink, so they give you IV fluids to keep you hydrated. Makes sense, right? But here's what they don't tell you. IV fluids inflate mom and inflate baby, and that causes 2 specific problems for breastfeeding. First problem, swollen breast tissues. When you receive liters of IV fluids during labor, especially if your labor is long or if you're being induced, that fluid just doesn't stay in your veins. It leaks into your tissues. Your hands swell, your feet swell, your face puffs up, and your breast tissue swells too. When your breast tissue is swollen and tight from IV fluids, it's a lot harder for your baby to latch on and mold that tissue into their mouth. Think about trying to gripe a water balloon that's completely full versus one that's half full. The one full is rigid, taut, hard to grasp. The half full one is moldable, soft. You can squeeze it and shape it. Same thing with breast tissue. Normal breast tissue is soft and pliable. Baby can compress it with their gums, draw it back into their mouth, and create a seal. But swollen tissue doesn't shift and mold easily. It's firm, it's engorged. Baby can't get a deep latch because the tissues won't compress, which makes latching harder and more painful for you and less effective for baby. You might see a lactation consultant try to manually express some of the milk to soften the areola before latching on, or they might use reverse pressure softening techniques. Second problem, inflated baby weight. Baby absorb those fluids too while they're in the womb. They're like a little sponge. So when they're born, they're carrying extra fluid weight, sometimes a lot of it. And then in the first day or 2 after birth, they pee out all that extra fluid, what makes it look like they're losing too much weight. Hospital protocol says that if a baby loses more than 7 to 10% of their birth weight, they need to be supplemented with formula. But here's the problem. If baby's birth weight was inflated by IV fluids and then they peed out the fluid in the first 24 hours, the weight loss isn't real. They're not starving, they're not dehydrated, they're just releasing extra fluid. But nobody explains that. So panic sets in and baby gets supplemented, even though they didn't actually need it. Here's what helps. If you take baby's weight at 24 hours instead of at birth, that's usually more accurate to their true birth weight because by 24 hours, they peed out most of the extra fluid. That's their baseline. And when you calculate weight loss from the 24-hour mark instead of from the inflated birth weight, baby's almost always within the normal range. Research actually backs this up. Studies show that babies born to mothers who have received large amounts of IV fluids during labor have artificially high birth weights that normalize by 24 to 48 hours. Just knowing this can take away the fear. You can ask for baby's 24-hour weight. And if you're being pressured to supplement based on weight loss, you can ask, how much IV fluid did I receive during labor? Could that be affecting baby's weight? Sometimes just asking the question makes the medical team pause and reconsider. Last intervention, C-sections. About 1 in 3 births in the United States is a C-section. Some are planned, some are emergency. All of them can affect breastfeeding. C-sections can delay your milk coming in, sometimes significantly. For moms who deliver vaginally, milk typically comes in around day 3 or 4. You feel like your breasts are getting full, warm, and heavy. That's when colostrum transitions to mature milk. But for moms who have C-sections, especially unplanned C-sections after long labors, milk can be delayed, sometimes up to 7 to 10 days. Why? A few reasons. 1, the hormonal surge that happens during vaginal delivery doesn't happen the same way during a C-section. The natural cascade of hormones that trigger milk production is disrupted. 2, if you labor for a long time before the C-section, your body is exhausted. It's been through trauma and needs time to recover before it can shift into milk production mode. 3, if you received a lot of IV fluids, if there was significant blood loss, your body is dealing with that first before it focuses on making milk. And 4, if you're separated from baby after delivery, or if baby goes to the NICU, or if breastfeeding is delayed because of recovery or pain, your body doesn't get the early stimulation and needs to ramp up milk production. So what happens in those first couple of days when your milk hasn't come in yet, there's only colostrum, drops of it, thick, golden, concentrated drops. And that's all that baby needs. Their stomach is the size of a marble on day 1, a ping pong ball on day 3. They don't need ounces of milk, they need teaspoons of colostrum. But if milk is delayed beyond day 4 or 5 and baby's losing weight, panic sets in. The pediatrician says baby needs to eat. The nurses say babies need to gain weight. If formula gets introduced, which baby's gut isn't ready for, especially if they're only a few days old. Formula bypasses the protective benefits of colostrum. It introduces proteins that baby's immature gut has trouble digesting, and it can set up a pattern where baby gets used to the fast flow of a bottle and has even more trouble latching on the breast. What can you do? Hand expression. Learn how to hand express colostrum is one of the most empowering things you can do if you had a C-section. Here's why. Hand expression allows you to see how much colostrum you're making. Even if it's just drops, you can collect it. You can measure it. You can know that your body is working. It also stimulates your nipples and breasts, which sends signals to your brain to make more milk. The more you stimulate, the more prolactin prolactin that gets released. And prolactin is the hormone that makes milk. And the baby can't latch well yet because they're sleepy from medication or because they're struggling with their mechanics, you can hand express colostrum and feed it to baby with a spoon, a syringe, or your finger. That keeps baby fed with your milk while you're both trying to figure out breastfeeding. So hang in there. It might take longer than you expect, but it will happen. So here's the bottom line. If you're planning a hospital birth, there's a good chance you'll have one or more of these interventions, planned or unplanned. Pitocin to start or speed up labor, an epidural for pain management, IV fluids for hydration, or a C-section if baby needs to come out quickly. These interventions save lives. They make birth safer. They give you options for managing pain and complications. Nobody's saying you shouldn't have them if you need them or want them, but knowing how they affect breastfeeding doesn't mean you can't have them. You know the first 6 weeks might be harder than you expected. You know that if baby's not latching well in the first hour, it might be because of that epidural. You know that if your milk is delayed after C-section, it doesn't mean your body is broken. You know not to panic if baby loses weight in the first day or two when you have IV fluids. You know to ask for your 24-hour weight instead of just your birth weight. You know how to keep baby at the breast even when it feels like nothing's happening yet, because the stimulation is doing the job even if you can't see milk. And most importantly, you know if someone throws a nipple shield at you without explaining why, or tells you to supplement with formula without checking your latch first, or says your body isn't making enough milk when you're only day 1 or day 2, you can ask more questions. You can say, could this be related to the Pitocin I received? Could this be because of the epidural? Could my breast tissue be swollen from the IV fluids? You can ask for help from someone who understands the connections between the birth interventions and the breastfeeding challenges. You can give yourself grace and time, because breastfeeding after a medicated hospital birth is generally harder, and that's not your fault. And here's the really good news. The research shows that by 6 weeks, the effects of these medications have cleared, and there's no difference in breastfeeding success rates between moms who've had interventions and moms who didn't. Which means if you can just get through those first 6 weeks, you're likely to succeed. But those first 6 weeks are when moms stop breastfeeding. Not because their bodies failed, not because they didn't have enough milk, but because they were exhausted. They were getting conflicting advice. Nobody explained what was actually happening, and they thought it was supposed to be easier than this. Now you know different. You know it might be harder at first, but you also know why. And knowing why gives you power, because you're informed, and information is power. If you're pregnant and you want to set yourself up for breastfeeding success, come see us before the baby arrives. Prenatal chiropractic care helps prepare your body for labor and delivery in ways that can make a real difference, because you're informed, and information is power. And if you're pregnant and you want to set yourself up for breastfeeding success, come see us before baby arrives. Prenatal chiropractic care helps prepare your body for labor and delivery in ways that can make a real difference. We'll make sure your pelvis is aligned so baby can get into optimal position for birth. We'll check for any restrictions in your spine or hips that can affect your comfort during labor or your ability to push effectively. We'll address nervous system interference so your body can function the way it was designed to, because the smoother your birth goes, the fewer interventions you'll likely need. And the fewer interventions you have, the easier those first few weeks of breastfeeding can tend to be. We can't guarantee you won't need Pitocin or an epidural or a C-section. Birth doesn't work that way. But we can help your body be as prepared as possible so that if interventions are needed, they're truly necessary. Drop a comment if this was helpful. Save this video if you're planning a hospital birth, you want to come back to it. And share it with a pregnant friend who needs to hear this, because the more moms know about this connection, the more empowered we all become.